Welcome to the deep dive. Today we're tackling a health challenge that, well, unfortunately crops up quite a bit in our larger canine friends. Cervical spondylomyelopathy.
Or CSM, yeah.
Right. Or as most people probably know it, Wobbler Syndrome. We've got some really detailed information here from a text focusing on this condition. Our goal today is really to, cut through the medical jargon and give you the essentials on Wobbler syndrome.
Absolutely. What it is, what causes it.
Exactly. How vets figure it out, and crucially, what the treatment options look like. So let's dive in.
Okay, so at its core, Wobbler syndrome, or CSM, is a disease affecting the neck, the cervical spine, mostly in large and giant breed dogs.
Right.
The fundamental problem is compression. Basically, something is squeezing the spinal cord or the nerve roots in that neck area.
Okay, compression.
And that pressure leads to, well, a whole range of neurological problems and sometimes neck pain, too.
So like you said, something squeezing, almost like a kink in a garden hose maybe, blocking the flow.
That's a great analogy, actually. That compression is the central issue.
And it seems there are a couple of main ways this blockage can happen.
That's right. We generally see two main types. First is disc-associated compression. This one tends to show up in dogs, usually older than 3 years.
Okay, older dogs.
And it's linked to the degeneration, the sort of wear and tear of those intervertebral discs between the vertebrae.
Makes sense.
What's particularly interesting here, especially with Doberman pinschers, is the potential role of the facet joints, those small joints connecting the vertebrae.
Ah, the joints themselves.
Yeah, it seems their specific joint structure might, possibly, make them more prone to extra rotational strain on the discs.
Huh. So a subtle difference in their build could lead to bigger issues down the line.
Potentially, yes. That's the thinking.
Okay, and the other type, sounds like that one's more about development, especially in those really big breeds when they're young.
Exactly. Bony-associated compression. This typically affects young giant breeds, usually under 3 years old.
Young giants, got it.
In these cases, it often involves actual malformations of the vertebrae. They just don't develop quite right and end up pressing on the spinal cord.
So the bones themselves are the issue.
Correct. And this bony compression can happen from different directions, top or bottom, from the side, sometimes a combination.
Yeah, I read something about movement being important. Dynamic compression.
Yes, that's a key point. Regardless of whether the root causes the disc or the bone, how the dog moves its neck almost always plays a role.
How so?
Well, think about that kink hose again. Bending it certain ways makes the blockage tighter, right?
Right.
It's similar here. Certain neck movements can actually increase the pressure on the spinal cord.
I see.
But, and this is important, current evidence doesn't really support the old idea that instability, like the spine being loose, is the primary cause.
Okay, so instability isn't the main driver, it's the compression itself, made worse by movement.
Precisely. The nervous system is the one feeling that squeeze.
And are there clues about why some dogs get this? You mentioned Dobermans. Are there genetic links?
There are definitely strong suggestions, yeah. An inherited basis has been proposed for breeds like Borzoi and Basset Hounds.
Okay.
And in Dobermans, the evidence points towards what's called an autosomal dominant inheritance, meaning it's likely a dominant gene, but with incomplete penetrance.
Incomplete penetrance. So they could have the gene but not show signs.
Exactly. A Doberman could carry the genetic predisposition but not necessarily develop the full-blown syndrome. It's complex.
Wow, okay. That is tricky. And how common is this condition?
Well, the source material suggests it's likely the most common neurological disorder affecting the neck in these large and giant breeds.
Really? The most common?
Seems that way, which really underscores how significant this is for people with these types of dogs.
Absolutely. Good to know. Any geographic pattern it's mentioned?
Interestingly, no. The text doesn't point to any specific regions, suggesting it's a concern for these breeds pretty much everywhere.
Okay, so let's zoom in a bit on who gets affected. We've said large and giant breeds, but can we be more specific?
Definitely. The Doberman pinscher really stands out. They account for roughly half of all cases.
50%. Wow.
Yeah, it's significant. Other breeds with a higher incidence include Great Danes, Rottweilers, Weimaraners, and Dalmatians.
Okay, those are some popular breeds.
They are. But it's really important to remember, while these breeds are predisposed, Wobbler syndrome can technically affect any breed, even smaller dogs, though it's much, much less common.
Good point. So it's not exclusively a big dog issue, just predominantly? What about age? When do signs usually pop up?
It tends to differ a bit. For Dobermans and other large breeds, signs often start appearing when they're a bit older, say over 3 years old.
Yeah.
The average is around 6 years.
Okay, middle-aged for large breeds.
Right, but for the giant breeds, like Great Danes, it often presents much younger, typically before they hit 3 years old, though you can see later presentations sometimes too.
And any difference between males and females?
There's a slight tendency for males to be overrepresented, but that seems to be mainly noted in the giant breeds.
Okay, so we have a picture. Dobermans, giant breeds, often younger, large breeds, often middle-aged, maybe slightly more males than giants. Now, the crucial part for owners, what are the signs? What should people be looking out for?
The most classic presentation is a slowly progressive ataxia, especially in the hind limbs.
Ataxia, meaning clumsiness, wobbliness.
Exactly. An uncoordinated wobbly gait. That's where the name Wobbler Syndrome comes from. The back legs usually look worse than the front legs, at least initially.
So someone might notice their dog seems unsteady in the rear, maybe scuffing their back paws.
Precisely that. Scuffing nails is a common sign, and often the history owners give is this chronic, slowly worsening gait problem over months or even years.
Slowly worsening. But can it happen suddenly?
It can. Sometimes you see an acute sudden onset, often associated with obvious neck pain. Or a dog with a mild chronic history might suddenly get much worse.
And neck pain itself, is that always present?
Neck pain, or what vets call cervical hyperesthesia, basically increased sensitivity in the neck area, is pretty common. Reported in maybe 65–70% of Dobermans, a bit less, maybe 40–50% in other breeds.
So common, but not guaranteed. Now, when the vet does a neuro exam, what specific things are they looking for?
Well, interestingly, while neck pain is common for owners to notice, it's actually rare for it to be the only complaint, maybe only 5% of cases.
Okay.
The gait changes are almost always there. That proprioceptive ataxia, the lack of awareness of where their limbs are.
Right, the not knowing where their feet are feeling.
Exactly, leads to that wobbly walk. And paresis, which is just weakness.
Weakness too.
Yes. And like we said, usually more obvious in the hind limbs if the compression is lower down in the neck, like C5-6 or C6-7 level.
And if it's higher up?
If the lesion is higher, say mid-cervical, you can see ataxia and weakness in all 4 limbs. The front leg gait can look kind of short-strided, maybe stiff or floating, or sometimes just very weak.
Okay. What about reflexes and things like muscle tone?
Proprioceptive deficits, like when the vet flips the paw over to see if the dog corrects it, are usually present, but maybe not super obvious in chronic cases. The gait exam itself, seeing the ataxia, is often more sensitive.
Got it.
In severe cases, sadly, dogs can become non-ambulatory, unable to walk at all.
Oh, wow.
You might also see muscle wasting, especially in the shoulder muscle, the supraspinatus, and those worn toenails we mentioned.
Okay.
Muscle tone is often increased in the extensor muscles, the ones that straighten the legs in all 4 limbs. The knee-jerk reflex is often normal or even exaggerated, and the withdrawal reflex in the front legs, pulling the leg back from a pinch, might actually be a bit harder to get because of that increased stiffness.
So it's a whole constellation of signs, gait, reflexes, muscle changes. Let's shift to causes. We touched on discs and bone malformations. Are there other factors? Is it just bad luck?
It's likely multifactorial, meaning several things probably contribute. We discussed the genetic angle. There were also some older theories, especially for Great Danes, about nutrition, like too much protein, calcium, or calories during growth.
Right, you hear that sometimes about giant breeds.
Yeah, but the current thinking, based on the evidence, is that nutrition probably doesn't play a significant role in CSM development in large breeds generally.
So those dietary links are mostly considered outdated now for wobblers.
For the most part, yes.
What about other ideas, like their build, big head, long neck, or growing too fast?
Those have been proposed. The idea that conformation, like a large head and long neck, is a risk factor. Well, more recent studies haven't found a strong link there, and rapid growth rate. Also suggested, but again, research hasn't consistently confirmed it as a definite risk factor for CSM itself.
So it sounds like the exact recipe is still a bit murky, but genetics and those structural neck issues seem to be the main ingredients we know about.
That sums it up pretty well.
Okay. So how do vets actually nail down the diagnosis? It sounds like other things could look similar.
Diagnosis is definitely a process of elimination sometimes. You have to rule out other possibilities first.
Like what?
Orthopedic problems, for instance. Hip dysplasia, or a torn cruciate ligament in the knee, can cause hind limb lameness or gait changes,
Sure.
But the key difference there is usually the lack of that specific neurological ataxia, that uncoordinated wobble you see with CSM.
Ah, okay. The type of gait change is different.
Exactly. Then there are other spinal issues to consider: spinal tumors, things called subarachnoid diverticula or synovial cysts, infections like discus spondylitis or osteomyelitis, inflammation like meningomyelitis, or even trauma.
Wow, quite a list.
Yeah. Imaging and sometimes CSF analysis help differentiate those.
What about basic blood tests? Do they help?
Not really for diagnosing CSM itself. Standard blood counts, biochemistry, urinalysis, they're important for checking overall health, ruling out other diseases, making sure the dog is safe for anesthesia if needed, but they don't point specifically to wobblers.
So imaging is really key then. Where does that usually start?
Often with cervical radiographs, just standard x-rays of the neck.
Okay.
They're useful for ruling out obvious bony issues like fractures or bad infections. You might see things like narrow disc spaces or slight vertebral tipping, but those findings aren't specific to CSM.
Meaning healthy dogs might have them too.
Exactly. Healthy large breeds can show those changes. In giant breeds, you might see arthritic changes in the little facet joints on x-ray. So x-rays give some clues, but they're not definitive.
Right. So what's the next step up from x-rays?
Usually myelography.
Yeah.
This involves injecting a special contrast dye around the spinal cord and then taking x-rays.
Okay, dye plus x-ray.
Yeah. It lets the vet see the outline of the spinal cord and identify where it's being compressed and from which direction: ventral, dorsal, lateral, front, backside.
That sounds more specific. Any downsides?
Well, sometimes they do stressed views where they bend the neck into different positions during the myelogram. This can sometimes, rarely, make the neurological signs temporarily worse.
Oh, okay. Risk there.
A slightly safer variation is linear traction myelography, which involves gently pulling the neck straight. That can help distinguish if the compression is always there, static, or if it changes with neck position, that dynamic component again.
I see. And then we get to the really advanced stuff, CT and MRI.
Absolutely. Those are often the go-to now. CT myelography combines a CT scan with that contrast dye. It gives fantastic cross-sectional, like slice-of-life, views of the compression.
Better detail.
Much better detail of the bony structures, yes. And it can sometimes show if the spinal cord itself has started to shrink or atrophy due to the pressure.
And MRI.
MRI, magnetic resonance imaging, is arguably the gold standard. It's excellent at visualizing the soft tissues, the spinal cord itself, the discs, ligaments, nerve roots.
Not just bones.
Right. You can see it all in multiple planes or slices. And a huge advantage of MRI is that it can show signal changes within the spinal cord tissue itself.
What does that tell you?
Those signal changes often indicate swelling, bruising, or even permanent damage right at the spot where the compression is worst. It helps pinpoint the primary site of injury more accurately than myelography or CT often can.
So MRI gives the most complete picture, it sounds like. Are there other tests, like analyzing the spinal fluid?
Yes, CSF analysis or a spinal tap is often done. Usually in Wobbler cases, the CSF is actually normal.
Oh, okay.
But sometimes, especially if it's a more acute case, you might see a mild increase in inflammatory cells. In really chronic cases, the protein level in the fluid can sometimes be a bit elevated.
So mostly normal, but can sometimes give subtle clues. What about looking at the actual tissue damage? Is that ever done?
Looking at the pathology, the microscopic changes, is usually something done either from surgical biopsies or, more commonly, post-mortem if a dog passes away or is euthanized.
I see. What do they typically find?
At the compression site, you see demyelination. That's the loss of the protective myelin sheath around the nerve fibers in the white matter.
Damage to the insulation, basically.
Good way to put it. There's also often axonal damage, harm to the nerve fibers themselves, which leads to downstream degeneration called Wollerian degeneration.
Okay.
In the gray matter, you can see loss of nerve cells, scarring called gliosis, even tissue death, necrosis. And if the compression is really severe and chronic, you can get focal myelomalacia, which is a softening of the spinal cord tissue.
Wow, so that compression really sets off a cascade of damage over time.
It does. It's quite significant.
This is all really critical for understanding the condition. Okay, let's move to the big question. What can actually be done? What are the treatment strategies?
Broadly, treatments fall into two main camps: surgical management and medical management.
Surgery or medicine?
Right. If surgery is the plan, that obviously requires the dog to be hospitalized, inpatient care. Medical management is typically handled on an outpatient basis.
And for dogs that are really struggling to walk, non-ambulatory dogs, what kind of care do they need?
Oh, intensive nursing care is vital. Soft, padded bedding is crucial, and they need to be turned frequently, maybe every 2–4 hours, to prevent pressure sores.
Right.
Bladder management is often needed, sometimes requiring a urinary catheter, and physical therapy is really, really important.
Why physical therapy?
It helps prevent severe muscle atrophy, keeps the joints from getting stiff or fused, ankylosis, and it's essential for promoting recovery and helping them potentially walk again.
Makes sense. Lots of hands-on care. What about activity levels during treatment?
Strict activity restriction is absolutely key for both approaches.
Okay, how long?
For medically managed dogs, at least 2 months of confinement leash walks only for bathroom breaks. No running, jumping, playing.
2 months minimum. And after surgery.
Similar time frame, usually 2 to 3 months of restriction. This allows time for any bone grafts to fuse and for surgical implants, like screws or plates, to become stable.
Got it. Very restricted. Any diet changes recommended during treatment?
Specifically for giant breed dogs with that bony compression type, it's generally advised to avoid diets excessively high in protein, calcium, and calories. Sort of harking back to those older growth concerns. Even if the direct link to CSM isn't proven, it's often considered prudent.
Okay, a precaution mainly for the young giant breeds. Now, surgery sounds like a big deal. What should owners know if they're considering that route?
The main message is that surgery generally offers the best chance for significant improvement. The success rates are often cited around 80%.
80% improvement is pretty good.
It is. But owners also need to be aware of the risks. Cervical spine surgery isn't minor. There's a small but real risk of significant complications, maybe in the 1 to 5% range. Things like worsening neurological signs, implant failure, infection.
Okay, important to weigh the potential benefits and risks. What kinds of surgeries are actually done?
There are several techniques, and the choice depends heavily on the type and location of the compression. For single compressions on the underside, the ventral side, a ventral slot procedure is common. It's like drilling a window in the bottom of the vertebrae. Sometimes it can be used for 2 adjacent spots.
Okay, ventral slot. What else?
For compressions coming from the top, dorsal or side, dorsolateral, or sometimes for multiple ventral ones, a dorsal laminectomy is done. That involves removing part of the bony roof of the spinal canal.
Opening it up from the top.
Exactly. Then there are techniques focused on stabilizing the vertebrae, often involving fusion. These distraction stabilization fusion procedures are often used for those dynamic ventral compressions, but can be adapted for multiple levels too.
Stabilizing and fusing.
Yes. And a newer option is cervical disc arthroplasty, basically, replacing the diseased disc with an artificial one. Early results seem promising. It appears safe and effective and might be good for multiple compressions too.
Artificial disc replacement. Interesting.
It is. One important thing to note, though. No matter which surgery is done, there's about a 20% chance of recurrence of clinical signs down the road, maybe due to adjacent segment disease, where the next disc goes bad.
20% recurrence.
Okay. Anything that doesn't work well.
Fenestration, where they just cut a window in the disc itself, is sometimes used for other types of dog disc disease, but it has a really low success rate for wobblers and isn't generally recommended.
Good to know. So multiple surgical options, but recurrence is possible. What about medical management? When is that used?
Medical management is often considered for dogs with milder signs, or if surgery isn't an option due to cost, other health issues, or owner preference.
Makes sense. What does it typically involve?
The cornerstone is that strict activity restriction we talked about for at least 2 months, plus medications.
What kind of meds?
Corticosteroids, like prednisone or dexamethasone, are usually the first choice to reduce inflammation and swelling around the spinal cord.
Steroids.
Okay.
They're typically started at a higher anti-inflammatory dose and then slowly tapered down over several weeks. For pain, especially neck pain, gabapentin is often added.
Are there side effects or things to watch with those drugs?
Yes, definitely. With steroids, owners need to watch for increased thirst and urination, increased appetite, panting, and more seriously, potential gastrointestinal upset or even bleeding. Bladder infections, cystitis can also be a risk.
Okay.
Sometimes vets prescribe stomach protectants, like proton pump inhibitors, alongside the steroids. And it's absolutely crucial not to combine corticosteroids with NSAIDs, non-steroidal anti-inflammatory drugs.
Right. Never mix steroids and NSAIDs. Can NSAIDs be used instead of steroids?
Sometimes, yes. For very mild cases, maybe just some neck sensitivity or very slight unsteadiness, an NSAID like meloxicam might be tried first, often along with activity restriction and maybe gabapentin.
So medical management is a real option, especially for milder cases. How do vets keep track of whether treatment is working?
Regular recheck neurological exams are essential. Whether the dog had surgery, or is being managed medically, the vet needs to periodically assess their gait, reflexes, and pain level to see if they're improving, staying the same, or, unfortunately, getting worse.
Makes sense. Ongoing monitoring. Before we wrap up, are there any preventative measures owners of susceptible breeds can take? Anything to lower the risk?
Well, there's no guaranteed prevention, unfortunately, since genetics likely plays a big role.
Right.
But the source material does suggest avoiding excessive high-impact activities, lots of jumping, rough and tumble running, especially when they're growing rapidly.
Kind of common sense for big growing pups anyway.
Exactly.
Yeah.
And using a body harness instead of the neck collar is strongly recommended for these breeds to avoid putting direct pressure or strain on the neck.
Good practical tip. Harness, not collar. Okay, so what's the overall outlook? What can owners generally expect long-term?
The prognosis really varies. As we said, with surgery, roughly 80% of dogs show improvement, which is quite good. With medical management, that strict rest plus or minus steroids may be around 50% improve, and another 25% or so might remain stable. Not getting worse, but not significantly better either.
So medical has a lower success rate, but can still help many.
Yes. And remember, recurrence is a possibility with either approach down the line.
Okay. So early diagnosis and choosing the right approach seem absolutely vital. This has been incredibly informative, really breaking down a complex condition. Let's just quickly hit the main takeaways.
Sure. So Wobbler Syndrome, CSM, is about spinal cord or nerve root compression in the neck of large and giant dogs.
Key breeds, Dobermans, Great Danes, Rottweilers, Weimaraners, Dalmatians, but others possible.
Signs usually involve that progressive wobbly gait, worse in the hind limbs, sometimes neck pain.
Diagnosis needs advanced imaging, MRI is often best.
Treatment is either surgery, with about an 80% improvement rate but risks and potential recurrence, or medical management with strict rest and meds, improving about 50%.
And early detection is critical. Spotting those subtle gait changes or neck sensitivity early makes a difference.
Absolutely. Seeking vet attention promptly is key for these breeds if you see anything suspicious.
Definitely. You know, thinking about all this, the complexity, the genetics, the surgical challenges, the variable outcomes, it really makes you wonder, doesn't it? What's the next step? Could better understanding of the specific genes involved or maybe further refinements in those surgical techniques like the artificial discs lead to even better prognosis for these dogs and their families in the future?
That's the hope, isn't it? Continued research is vital.
It really is. Well, that's certainly food for thought. Thank you so much for walking us through all that, and thank you for joining us for this deep dive into Wobbler syndrome. We'll catch you next time.